Hi everybody, I'm sorry I cannot be with you today. I had a previously scheduled workshop that I need to attend. I hate that it is on our first day back after such a long break, but I did want to finish up this little bit that is left of the chapter with you. So I decided to make a video so that I could be with you at least virtually this morning. So we had left off on, it is on page 68 in your book, 2.5, Infertility and Assisted Reproductive Technology. And so this is where we are. And on this first slide, we're looking at the causes of infertility. And we begin by looking at fertility issues with men. And I do have that highlighted, fertility problems among men. And some of the reasons here, so I have that particular line, fertility problems among men, highlighted. And then there are several possibilities of what could cause the problems. Low sperm count, deformed sperm, low sperm motility, diseases. Diseases is also highlighted on my PowerPoint notes. Injury of testes, and autoimmune responses. So just as a little recap, and diseases would be things like sexually transmitted diseases. And so just as a recap, the diseases such as sexually transmitted diseases can cause fertility problems amongst men. So the causes: genetic factors, environmental poisons, diabetes, STIs, overheating testes, pressure to testes, aging, and drugs. There is a true or false on page 69. Yes, extensive athletic activity can contribute to infertility. So that was one of our truth or fictions from the beginning of the chapter. So the next slide, what are the causes of infertility, part 2? Major infertility problems among women. So that is highlighted in my notes, as well as the next line. The irregular or absence of ovulation is one of the major fertility problems. Fertility drugs are used to cause women to ovulate, and declining hormone levels due to aging, and endometriosis. And the definition of endometriosis can be found on page 69 in your textbook. And there they tell us that it's the inflammation of the endometrial tissue, and it's sloughed off into the abdominal cavity rather than out of the body during menstruation. And the condition is characterized by abdominal pain and sometimes by infertility. And that is also highlighted as a fertility problem among women, and as well as the last thing, which is obstructions or malfunctions of the reproductive tract. So again, 3 particular causes of infertility in women are highlighted on my slide: irregular or absence of ovulation, endometriosis, and then the obstructions or malfunctions of the reproductive tract. Okay, then the causes: hormone irregularities, stress, malnutrition, infections that produce obstructions, as from scarring such as PID, pelvic inflammatory disease. We have definitions again on page 69 if you're looking for some definitions there. How are couples with fertility problems assisted? Artificial insemination. There is some videos, if I'm not mistaken, in your course as well with some of these. So artificial insemination, that is, you can see page 70, some more information about that. And that is where the sperm is injected into the mother's uterus. Now, in vitro fertilization is different because the ova and the sperm are fertilized outside of the body and then implanted in the mother's uterus. So the sperm and the ova outside in a petri dish are fertilized and then put back into the mother. And then donor IVF. That's where an ovum is harvested from a donor woman, fertilized in vitro, and implanted in a recipient's uterus. Embryonic transplant is sometimes what that is called. So definitions there are on page 70 and 71, and there is a truth or fiction on page 71. It is not true that test tube babies are grown in a test tube, but close. In this method, more technically known as in vitro fertilization, ripened ova are removed surgically from the mother, placed in a laboratory dish. The father's sperm are also placed in the dish, and one or more ova are fertilized and then injected into the mother's uterus to become implanted. Nothing on this slide of mine is highlighted. Some other ways that fertility problems are treated: surrogate mothers. Again, definition, page 71. This is a substitute mother who carries a baby to term for another woman. Some ethical and legal risk because the surrogate mother may not want to give up the baby after carrying it for the term of the pregnancy. And then another option, page 72 at this point in your book, is adoption. And this is greater diversity of adoptive children and adoptive parents. And we need to have consideration of the adopted children's needs. And relinquishing mother also experience effects. So, in different states, the rules on adoption vary drastically. So that is a real important thing to also know, that it's not a nationwide set of rules. A lot of these, like surrogate mother, adoption, and some of these other things, the rules and laws that govern those vary from state to state. I have nothing in those last 3 slides highlighted in any of mine. So that is the end of chapter 2, and hopefully that helped just finish up. I didn't want you to miss those last couple highlights that were there. You will, as promised from previously, have more time for this quiz, and we have very specifically mentioned those highlights as we've gone through the chapter, so I do hope that that will help. Good luck with the quiz, and I look forward to being with you in the next class. Take care.